Support is basically it's a group set of techniques where you provide to the patient who had a cardiac arrest or in a respiratory distress to till the medical emergency arrives the spot. Okay, in an emergency, the first few seconds will your actions will make a lot of difference for the patient. Whether the patient suffered a cardiac arrest or a respiratory distress, the knowing how to do resuscitate the patient will make a lot of difference for the patient. In today's session, we will teach you about what is the basic life support and what are the techniques we have to use during the basic life support, and you will be able to acquire the skills, and also next time you will get a confidence also, where when the in the future if the situation arises where you need to support some patient. Okay, and the other thing is, with the flow of the talk will be, initially we have a PowerPoint presentation where we'll emphasizing the important points of each step, and we'll discuss about some of the emergencies, common emergencies what we encounter in our daily practice. And we have with us joined Dr. Vamsi. He is a emergency medicine consultant. He will take through the PPT, and once the PPT is over, we have a mannequins available here. We will demonstrate you, and we make you to demonstrate and how to do chest compressions and deliver breaths to the patient. Okay, Mike, over to Dr. Vamsi. It will be more interactive session. We will want to know what is your understanding about the disease. When you understand the disease, it is you will give better care for the patient. That's what we will ask a questions. I recommend you to come forward and make the session more interactive, so that we can understand what is your level of knowledge about the disease process. Okay, Mike, Dr. Vamsi.
Hi, good morning, Citadel. Everybody had your breakfast? All ready for the session? I am Dr. Vamsi Krishna. I work as a consultant emergency medicine at Century Hospital under the guidance of Dr. Dinesh sir. Okay, we all work as a team for all the emergency cases there. Today we'll have a small session on BLS, which means basic life support. Okay, which means without any equipment or anything, what can be done when we see somebody on the road or at the malls or at the hospitals or at the airports, most local places where we go, when we find somebody unconscious or unresponsive, what are the basic steps what we can do so that we make a difference when the patient is arrived at the hospital? Because you are the only person who has seen it, and you are the only person who can make the difference. Okay, when the person comes to the hospital with that CPR and we get great response, it's all because of you and your efforts. Okay, so we'll try to learn in the easiest way possible. Okay, anybody who has attended these sessions before, already you have some knowledge about BLS?
I mean, I last attended when I was in 10th standard, so pretty long time. I just wanted to attend it again.
Yeah, nice. Anybody who has already attended these kind of sessions? Good, sir. So let us make it more interactive. Let us talk and understand the topic better. Okay. So, sir, generally, what do you do when you find somebody unresponsive? So, suddenly, everybody is comfortable in Telugu? No, okay. We'll go ahead with English only. So, if somebody, you went to a mall or a beauty parlor or somewhere and you suddenly find somebody lying on the floor who is not responding, so what generally we do?
Check for breath.
First of all, we check the pulse.
Yeah. Good, sir. So, see, we are getting multiple responses. Okay. So that's what we'll make all these responses in a streamlined way. Okay. We learn 5 simple steps. Okay. You have to repeat those steps with me and do on this mannequin so that we get that knowledge. Okay. And I request you to go back home, share with your persons also, so that you repeat yourself and they get that skill, attending or not attending the session. Okay. So generally what is recommended by WHO is when somebody is unresponsive, what we do in the initial step is called scene safety. That is because if somebody we find on the road, we can't resuscitate him on the road itself because there are a lot of traffic issues, there are a lot of issues. Or in the airport, when you suddenly find somebody, you can't do it in the immigration. Okay, so we take the person to a site, which is called scene safety. Can you please repeat with me? Scene safety. Okay, in that we చెప్పినట్టు side కి తీసుకెళ్తాం మేము. తీసుకెళ్ళి we try to check his pockets and we'll see if he's responding or not. Because sometimes because of hypoglycemia, అంటే మన అందరిలో చాలా మంది sugars ఉంటాయి. So maybe somebody is carrying a sugar tablets or some gas tablets which he didn't take. He suddenly the sugar has come down and is unresponsive. So we'll get to know by checking his pockets or some drug abuse. Somebody would have caught carrying their drugs in the pocket, overdose. All these things to get a clue of why he's unresponsive is what we do in the first step, which is called scene safety. Okay, yes sir.
సార్ ఇప్పుడు మీరు చెప్పినట్టు పాకెట్ చెక్ చేయాలని చెప్పి అంటున్నారు. ఇన్ కేస్ హౌ డు వి నో దట్ పర్సన్ పడిపోయిన వాడు దానికే పడిపోయాడు.
అదే సార్ అందుకనే
టాబ్లెట్స్
మనం స్టెప్ బై స్టెప్ వెళ్ళాక అర్థమవుతుంది మీకు. అంటే ఫస్ట్ స్టెప్ మనం తీసుకెళ్ళినప్పుడు సాధారణంగా కొంచెం ఆయన బ్రీతింగ్ స్పేస్ ఇచ్చి ఒక సైడ్ తీసుకెళ్దాం అనమాట. తీసుకెళ్తున్నప్పుడు వీ కెన్ చెక్ హిస్ పాకెట్స్ టు గెట్ అన్ ఐడియా. అదా కాదా అనేది, అదే అని కాదు, అదా కాదా అనేది మనకు ఒక ఐడియా వస్తుంది అనమాట. Okay, so we can meanwhile while shifting him to a side, because we can't disturb the public also, we take him to a side, which is called scene safety. So next, as you said, we check the response. We want to know whether the person is conscious or unconscious. Is he breathing or he is not breathing?
Few more points I want to add here. Scene safety, one is the what sir told example that we have to suppose some accident happened, we have to take him to the footpath rather than in the road, because you started resuscitating somebody will roll over you. Okay, and other example, suppose a accidental fire happened in the apartment or some closed space. What happens, the fumes will come, carbon monoxide levels are very high. That's why we have to get the person out of that fire area and we have to take him to the safe place. Suppose the patient had sustained an electrical shock, somebody had a wire, he touched the plug box and he had a shock. We have to free from that electric wire and we have to take the victim outside. And if suppose in the patient, somebody drowned in the swimming pool, you don't know swimming but you try to save you also drown on the in the pool. First you have to get out of the water. These are the few scenarios I give you examples to make you more understand.
Okay, so we have taken the person to a side of a road or a place, a safe side where we are not injuring ourselves or the person who is lying down. So the next step is, the second step is checking the response. Okay, how do you check the response? Any idea? If maname padipayam anukondi, so how do you check response? Are easy awake, easy talking or not talking? So with pulse, you know heart is working or not. You are conscious or not, how can you tell? Yeah, you have seen in the movies also. General scenarios, we sprinkle some water on the face, on sea, but what medicine says is you have to tap on the most sensitive part of the body. Okay, you have to tap the person on the sensitive part of the body so that the senses go to the brain and evoke a response. After that also, if he is not responding, we consider him as unconscious or not responding. Okay, so the next question is, where is the sensitive part? Where do you want to tap? అక్కడ కొడితే వెళ్ళిపోతుంది అంటారు రెస్పాన్స్ ఫాస్ట్ గా. ఎనీ క్రియేటివ్ రెస్పాన్సెస్ ఇంకేమన్నా? సినిమా చూడలేదు, చంప మీద కొడతారు కదా, మోస్ట్ కామన్ రెస్పాన్స్ చెప్పట్లేదు మీకు. అంతేనా? Yes sir, but the common and the most important area where you check response is your collarbone. Okay, you have to always tap on the shoulder bones and see, because this bone is most sensitive and you get a faster response. Is a potential.
Like this, you have to tap. Because
So-
unconscious patient, if you tap like this, nobody will respond.
Already.
Are you okay? Like this, you have to respond.
కనిపిస్తుందండి బొమ్మ ఇక్కడ.
So you have to tap in a bit hard, okay?
Excuse me, I have a question.
Yes, please.
This is an emergency situation, right? So we're assuming that we're the
ఇక్కడ
only
కొట్టాలి.
here and there is no
Okay.
responsive authority available, so we're the only ones here. So what if like we panic and we're like, okay, we don't want to hurt this person. So how do you know?
There is no point of hurting him. He's already hurt. He's already hurt and lying down.
But it's still natural instinct to just be like, okay.
No, but here life is more important than hurting anybody. We are trying to save him. So you should not think we are hurting him. You have to think that we are saving him.
Yeah, but it's like more like a panic kind of situation. I guess.
That is the reason why they advise you to hit harder, because in that whole sound, because in a real life situation there's a lot of sound outside.
Yes.
There's a lot of traffic sound, everything. You can't hear what the person is saying who is lying down. So you need to hit the shoulders really hard and ask him, sir, are you all right? Sir, are you all right? Is the question you have to ask after hitting the collar bones with both the hands. As shown by the sir, you have to tap both the shoulder joints, collar bones, and then you need to ask. Okay? Team safety. అందరూ బ్రేక్ఫాస్ట్ తిన్నారు మాట్లాడట్లేదు ఎవరు అదే వాడు రియాక్ట్ అవ్వాలని కదా కొట్టేది
React అవ్వాలి. React
వాడి
అవ్వాలి.
రియాక్షన్ మనకు కావాలి. ఓకే హీఈస్ అన్కాన్షియస్, వీ వాంట్ టు మేక్ హిమ్ కాన్షియస్. కొట్టంగానే తెలివి వస్తే దట్ ఈస్ గుడ్, నువ్వు బాగా కొట్టినట్టే.
అంటే అక్కడ కొడితే ఏమైనా అవుతుందా అనేది క్వశ్చన్, ఏం అవ్వదని చెప్పి.
ఏమే
ఏదైనా ఇండియా స్టేషన్ లో పెడతాం.
Nothing will happen. Either he will awake or he will be remain same. Nothing will happen.
even if the bones are breaking, we are not concerned at that point of time, because life is more important. The ultimate goal is to save him. సో మనకు ఒక 2-3 బోన్స్ ఎదుగుతాయి అనే ఆప్షన్ కాకుండా మనం సేవ్ చేస్తున్నాము అనే ఒక ఉద్దేశంతో we need to work harder. Okay? So the first step is scene safety. We take the person to a side. Okay? And the second step is we are checking the response. How do we check the response? We tap on the collar bone and check the response. And the next step is, the next and the most important step is calling for help. Calling for help is the most important step in BLS, because everything can't be done alone. Okay? When we encounter an incident, we might be alone. మనం ఒక్కలమే ఉండొచ్చు అక్కడ. సో మనం ఒక్కలమే అన్ని పనులు అన్నిసార్లు చేయలేము. ఓకే? అండ్ జనరలీ ఇన్ దిస్ పానిక్ సిచ్యువేషన్ we can't do everything alone. So it's always recommended, and that is the only reason before checking the pulse, before CPR, this step has been in the 3rd rank. Okay? WHO has given this step 3rd position only because everything can't be done alone in a panic situation. Okay? You always need help, and you should not hesitate in calling for help. Calling for help is most important. ఎందుకంటే we need to compress the chest, we need to give the air breaths. సో రెండు ఒకటేసారి మనం చేయలేము. సో that is the reason why it's always better to call the help and go to the second, third, fourth step. Okay? So we're calling for help. So what do we tell the person whom we are calling? The question is whom to call, what to say when we call. అంతే కదా, మనం ఎవరికో ఫోన్ చేస్తున్నామో ఎవరికి చేస్తున్నామో ఏం చెప్పాలి? That is 2 important questions. So what do you think?
108.
Generally ambulance services,
100.
yeah, anything.
Nearest people are.
Yeah, nearest hospital, if you know anybody, nearest ambulance services. So what do you tell the ambulance service or the person you're calling? What do you want to tell him?
Whatever we observed, like if there are any injuries, if there are any.
Heavy injury, exactly injury.
Yes, sir. As you told, it's right. But before that, you have to, if you want to disclose your identity, it's good. It's not also, there is no issue. You can always tell him, I am on the road, I've seen so and so person lying down, please come. And the most important thing is the landmark, where they have to come. If you are a local aid, you know the area better, you always guide the ambulance to come faster. Sir, ila palana side opposite lo kinda padipoyadu ante they'll come faster. It's always better to tell them a landmark. Okay, this small opposite lo, like this post office, this is, so that they come to the place faster. Yes sir.
ఇన్ కేస్ ఇప్పుడు హైవేస్లో జరుగుతూ ఉంటాయండి. ఇప్పుడు హైవేస్లో మన మధ్యలో ఎక్కడ ప్లేస్ ఏంటో మనకు
అదేనండి, అప్పుడు ఏం చేయలేము. ఇప్పుడు వాట్సాప్ లో యూ షేర్ ద లొకేషన్ ఫాస్టర్ టు ది అంబులెన్స్ డ్రైవర్. ఓకే, యూ షేర్ ది లొకేషన్ ఫాస్టర్, దే డైరెక్ట్లీ కమ్. ఇన్ కేస్ ఇఫ్ మనం ఇక్కడ లోకల్లో చూసినప్పుడు ఏంటంటే వాళ్ళకి ల్యాండ్ మార్క్ చెప్తే దిల్ కమ్ ఫాస్టర్ అని. ద ఓన్లీ వే ఈస్ మన ఏం ఒకటే ఏంటంటే వీ హ్యావ్ టు గెట్ ది హెల్ప్ ఫాస్టర్.
ఐ మీన్ ఎనీ స్పెసిఫిక్ నెంబర్ దట్ ముందుగానే లొకేషన్ షేర్ చేసి వాళ్ళు
అంటే 108 లోకల్ నెంబర్ 108.
108. And the most important reason why we are calling is we are need to find the help, and the ambulance drivers will bring something really important with them, which is called AED. Respond with AED, which stands for automatic external defibrillator. Okay, so this AED is a device which generally checks the heart rhythm. Okay, it generally checks the heart rhythm. If the rhythm is abnormal, it can give a shock. Okay, so the most common cause of death in adults in India all over is cardiac. Okay, because of the cardiac arrest only majority of the deaths in adults will happen. So getting this device is the most important thing. So the ambulance driver gets that device, will switch it on, connect to the person. If the heart rhythm is abnormal and it is shockable, the machine will deliver shock. We'll show you that also. We have those devices with us. Okay. So, ekkada daka vacham? First step, scene safety. Next, checking response. Third is calling for help. And we disclose ourselves, don't disclose ourselves, but we'll tell them the landmark to get there faster. Okay? Then now this is the favorite step, checking the pulse. Okay, the fourth and the important step is checking the pulse. Ekkada is the question. Where do you want to check the pulse, and why do you want to check the pulse is the question. Next, and you have to tell us why. You have to ikkadaina, you have to tell us why you want to check there. Yes, sir, definitely, sir.
whether it is work
హార్ట్ బీటింగ్ ఉందా లేదా అని చెక్ చేయడానికి.
మన పల్స్ చెక్ చేసేది హార్ట్ బీట్ ఉందా లేదా అని. కానీ ఎక్కడ చెక్ చేస్తాం?
హార్ట్ అండ్
Okay. Any other responses? Yes, sir. As you majority of people know, we have to check the pulse where it is nearest to the heart.
yes
Okay, ఎందుకంటే that will be the pulse that will disappear last and appear first. అంటే మనకి పల్స్ వచ్చినప్పుడు ఫస్ట్ రావాలి, పోయేటప్పుడు లాస్ట్ పోవాలి. సో దాట్ ఈస్ ది ఏరియా we want, and we want to check the pulse there.
నోస్.
Okay, so generally we check in the neck area. Sir, neck area అంటున్నాం, నెక్ మరి ఇంత పెద్దగా ఉంది, where do you want to check ఇది నెక్ ఏరియా?
హియర్.
సార్ అదే సార్, అంటే మనం ఫోన్ చేసినప్పుడు ఇక్కడ అని చెప్పలేము అలాగా. యూ హ్యావ్ టు టెల్ సమ్ ల్యాండ్ మార్క్ యాజ్ ఐ టోల్డ్ యూ. సో ఫోన్ లో ఇక్కడ అని చెప్పలేము మనం ఎవరికైనా చెప్దాం అంటే.
హార్ట్ పేరు తెలియదు.
అదే, సో సరే ట్రై చేయండి ఏమన్నా. ఎనీ ల్యాండ్ మార్క్ వేర్ యూ వాంట్ టు లొకేట్ అండ్ టెల్ us సార్ ఇక్కడ చూడండి అని. సో జనరల్లీ మీ అందరికి ఇక్కడ యాడమ్స్ యాపిల్ అని కనిపిస్తుందా? దేర్ ఇస్ స్మాల్ స్వెల్లింగ్ హియర్.
If you see, everyone
ఫీల్ అవుతున్నారు అందరూ?
prominence over here, which is called as trachea. Okay, trachea. Okay, you have to slide little lateral to the trachea. You feel the pulse, called as carotid pulse, which is the nearest to the heart. Just you feel the center, the heart structure. You just come little lateral to that. You feel the pulse, like pulsations.
సో సరే, ఇప్పుడు అదే నెక్స్ట్ క్వశ్చన్ ఇస్ హౌ టు చెక్ ద పల్స్. సో మనం పల్స్ ఎక్కడ చూడాలని తెలుసుకున్నాం. సో హౌ టు చెక్ ద పల్స్, నెక్స్ట్ క్వశ్చన్. అంటే ఎలాగా అంటే మొత్తం మనం హ్యాండ్ పెడతామా, ఫింగర్స్ పెడతామా? ఫింగర్స్ పెడితే ఒక ఫింగర్ పెడతామా, రెండు ఫింగర్స్ పెడతామా? So all these are common questions.
సార్ ఎలా పెట్టినా పల్స్ వస్తుందా లేదా
ఆ సిచ్యువేషన్ అలా ఉంటుంది సార్. మీకు అలా అనిపిస్తుంది, అంటే కామ్గా ఉంది కూడా మీకు అనిపిస్తుంది, కానీ వెన్ యూఆర్ ఇన్ ద సిచ్యువేషన్ మీరు హ్యాండ్ పెట్టినా కూడా మీకు తెలియదు. So tell me, what is the landmark?
4 fingers, I think.
Yes, sir. First you have to locate this small prominence which is in the common terminology is called Adam's apple. Okay, and you go 2 to 3 centimeters away from it. Okay, and ideally you need to check with the index finger and the middle finger, 2 fingers or at least single finger. Ensafe check cheddam, etuvaip check cheddam. Which side you want to check? How much time you want to check in that situation?
ఎనీ సైడ్ మనకు తెలిసినంత వరకు ఇఫ్ యు ఫీల్ ఈ పర్సన్ ఇస్ రెస్పాండింగ్ సంథింగ్ ఇంటర్నల్ తను రెస్పాండ్ అవుతున్నాడు అంటే
Then we can
అండర్స్టాండ్ ఇంకా బతిగా ఉన్నాడు.
ఇలా రెండు వైపులు చెక్ చేసి ఇచ్చా. పొరపాటున మీరు మీ ఫ్రెండ్ ఇద్దరు కలిసి రెండు వైపులు నొక్కేశారు అనుకోండి, ఉన్న కొంచెం పల్స్ కూడా పోతుంది. So what to do? So one of the person will take the initiative of checking the pulse. You check with couple of fingers 2 to 3 centimeters lateral from the prominence which is called Adam's apple. Okay?
Either side.
Any of the side. Generally on the side of the patient we are standing. అంటే నేను లెఫ్ట్ సైడ్ ఆఫ్ ద పేషెంట్ నుంచి ఉంటే లెఫ్ట్ సైడ్ నెక్ దగ్గర పల్స్ చెక్ చేస్తాను. నేను రైట్ సైడ్ నుంచి ఉంటే రైట్ సైడ్ చెక్ చేస్తాను. అందుకని నాకు ఇక రెండు సైడ్లు పెట్టి యూ డోంట్ బ్లాక్ బోత్ ది పల్సెస్. ఓకే, on whichever side of the patient you are standing, ideally that is preferable. Okay, అర్థమైంది కదా? So you have checked the pulse is not there. And one more most important thing what we do while checking the pulse is, so ideally what we need to do is when we are checking the pulse, you have to go near the patient, and if you can appreciate, you need to see the breathing also. Is the chest rise available? Is he breathing? Okay, when you go down to check the pulse, you need to slightly observe. It is very difficult in that open panic situation, but if you can, it is appreciated. Okay, while going down and checking the pulse, kindly see, is the chest rising? Generally in conscious and healthy people, when we take in and take out the breaths, our chest will minimally rise and come back. So you need to observe that those small changes when you go down and check the pulse, because if it's not breathing also, then you need to give the oxygen support also. Okay, that will come in the later step. Okay, so the first step is scene safety. So the next step, checking the response. Where do you check the response?
In the
Tapping on the collarbones. And the third step is calling for help. And the fourth step is check the central carotid pulse. Okay, చెప్పండి, central carotid pulse. So the ideal time is, ఎంతసేపు చెక్ చేస్తాం? ఎనీ ఐడియా ఎంతసేపు చెక్ చేయొచ్చు అలాంటి సిచ్యువేషన్లో? అంటే మనం పల్స్ ఉందా లేదా అని చెప్పుకోవడంలోనే వెళ్ళిపోయింది అనుకోండి, ఇట్స్ డిఫికల్ట్. సో హౌ మచ్ టైమ్ డూ యూ వాంట్ టు చెక్?
20 is too long.
20 seconds.
Yeah, ideally
Less than 10 seconds,
Ah.
both. We have to do simultaneously both things, checking the pulse and assessing for the chest rise. Normally, if the patient breathes, the chest will rise and again fall back. Like that, we have to observe here. Okay, both things has to be less than 10 seconds. We have to decide.
okay, and the most important thing is the answers always lies in yes or no. ఉందా లేదా, ఉండొచ్చు, ఉందేమో, there might be pulse. So there is no might be, if, buts there. Okay, you feel it, you say yes. If you not feel it, you say no. If you are in confusion, always say no. Okay, మన confusion లో ఉన్నా we have to always say no, because doing CPR is not a harm. Okay, if he is responding, he'll wake up. But absent pulse, you say yes and the CPR is not done, that is a big issue. Okay, in confusion, we always say no.
Sometimes what happens is when we feel with our fingers, actually there is no pulse. But what you feel is your pulse may you appreciate as a patient pulse. That mistake will happen even with some doctors also. That's what we have to be little cautious. If you are in confusion, you assume it as no only.
So it's always in confusion, no. And the answer always lies in yes or no. Okay? So, scene safety, checking response, calling for help, and checking the pulse is done, and still there is no pulse. So, the next and the important step is called CPR. CPR stands for cardiopulmonary resuscitation. Okay?
Cardiopulmonary resuscitation.
Yes. So, generally what happens is our heart, as you all know, it is divided into left-sided heart and right-sided heart. Okay? So, the left-side heart pumps the blood to the whole body, and the whole body includes the lungs as well. Okay? The blood from the left heart goes to the lungs and the rest of the body. So, while returning, the blood goes to the lungs, and as we breathe in, the oxygen from the lungs goes to the blood, and the blood comes to the left side of the heart, and the left side of the heart pumps the blood to the rest of the body. This is the circulation. Okay?
Why we need to do CPR? Why it is important?
So that we are mimicking what the heart does. So, and when we're giving blood, so that the oxygen stays in the blood, and we're mimicking the compressions like that the heart makes through external compressions.
Why is important is because if you see we have different organs like liver, kidney, brain. These are different organs, gut, muscles, everything. Okay, what happens is when the patient has a cardiac arrest, even liver, kidney, they can tolerate some amount if the blood is cut down for some time. But your brain is not like that. It is very sensitive organ. If you cut down your blood for 10 minutes, even though after 10 minutes the patient gets to conscious also, his brain is irreversibly damaged. Although the heart, every other organs will function, your brain will irreversibly damage. He remain unconscious for the rest of the life. That's why the CPR is as much early you can give, the chances of recovery will be much higher. That's what it has got an importance of bystander CPR. Means who is the person next to them has to provide the care to the patient. Because in Indian scenario, what happens is by the time the ambulance will reach to the spot, it's almost take 15 to 20 minutes in Western countries. In our Indian scenario, take 30 minutes, sometimes even 1 hour also it will not wait. We can't wait for the ambulance. We have to provide the basic life support till the emergency will arrive. Okay.
Okay, so for that, the most important thing what we have to do is, while doing CPR, we are doing CPR to push the blood to the brain. As sir just told you, we need to push the blood from the organs to the brain, because we need to perfuse the brain as more as possible, as fast as possible. Okay, so continuous CPR and good CPR will always give you great results, because we are saving a person, but he is not talking, he is lying on the bed. It's definitely difficult for the family and for us. So we want to make the person active also. We are saving lives and we want to make the person active also. Okay, so that he speaks like before. So that is the reason why we do CPR. So that we push the blood to the brain as much as possible, as quick as possible. So that the blood from the heart carries the oxygen to the brain and the brain cells do not die. Okay? So we'll now learn how to do a CPR or anywhere. Try to see and make the person lie down on a hard surface. Okay? And we open his whatever the upper garments are. If he is wearing a shirt, we open the chest and expose the chest. We open the shirt and expose the chest. And now most important question is, where do we do CPR? ఎక్కడ చేస్తాం మనం CPR? అది సార్ అంటే లొకేషన్ చెప్పాలి. ఎనీ మిడ్ పాయింట్ ఎక్కడ? Yes, you're talking to me on a phone. How do you convey me? You can't show this. So always there is a landmark again. Okay, you have to tell them, if you draw an imaginary line between two nipples. Okay, we draw a horizontal imaginary line between two nipples, and exactly at the midpoint of that we do CPR. Okay, there is a bone called sternum on which we do CPR. Okay, we draw an imaginary line between the two nipples, and exactly at the midpoint of that we do CPR. And how to do CPR and what is the position you have to take before you do CPR? Interlock this dominant hand with the non-dominant hand, like this. Okay? And the most important thing is you don't do CPR with your fingers. It is always heel of your hand you have to do, because your fingers will get fractured while doing CPR. So always do it with the heel of the hand, never with the fingers, because you apply lot of pressure. Improper pressure will leads to fractures. So it's always dominant hand interlocking with non-dominant hand.
We have to palpate the sternal bone. Like this, we have to palpate the sternal bone, and the lower end of the sternal bone you have to keep of your dominant hand. Okay, other hand you interlock from the above. Okay, like this, and when you are doing CPR, your elbow should be straight and your shoulder should be stiff. Okay, like this. You should not do like this, because when you are doing like this, your pressure may not be translated into compression. Okay, it should be straight enough, and your heel should touch the sternum of the patient, not whole hand, because the pressure will dissipate all. We want center more pressure rather than dissipating our pressure what we are giving. Okay.
డిఫరెన్స్ ఏమైనా ఉందా ఇప్పుడు మనం చేసేటప్పుడు ఈ స్ట్రైట్ గా చేయాలా లేదా క్రాస్ గా
No, no, no. Center straight. Because why we are doing CPR is it is laid between the two hard structures. One is the sternal bone, back is a backbone. Okay, you are compressing basically between the two hard structures. Okay, then only your compression will be. Suppose this is kept in the some cushion, but whatever you are giving pressure, the cushion will get down. That's what we prefer to keep on the hard surface. Under the lower part of the sternum you have to palpate, and lower 1/3 you have to keep. Okay, you have to keep your heel touching the patient, and you have to do CPR like this.
And main question, what is the pressure?
We tell you, sir. We tell you. Give us 5 minutes.
So this area only we need to do, right? Suppose we do it here.
So
You have to feel yourself sternal bone, lower end of the sternal bone. Everyone can feel lower end of the sternal bone. You have to
Exactly here. Little down.
little down. Lower end, lower 1/3. If you divide your this bone into 3 parts, lower end of the you have to keep like this. Okay, this is how it is. No, if you do little bit low, you are pressing the stomach. It will cause vomiting for the patient. Okay, that's what you have to lie in the lower part of the sternum.
we want all of you to put the pressure from the hips, not from the shoulders or the elbow. So for that you need to go as close as possible to the patient and be on the top of the patient like this, and hold both your hands like this and do it with the heel. Always with the heel. Okay, upward directed. Okay, మీరు ఈజీగా చెప్పండి, ఇట్లా పైకి పెట్టుకునేనా విత్ ద హీల్ యూ హ్యావ్ టు టచ్ ది లోవర్ పార్ట్ ఆఫ్ ది స్టర్నమ్ అండ్ స్టార్ట్ కంప్రెసింగ్. ఓకే, అండ్ యూ షుడ్ ఆల్వేస్ allow the recoil also. We have to press and allow the recoil. Yes, and allow the recoil. Okay, generally we do up to 2 to 3 inches into the chest. Okay, 2 to 3 and 4 to 5 centimeters or 2 to 3 inches into the chest we do, and we allow the recoil.
At least for adult, at least 5 centimeter depth you have to maintain. Why it is important is we have to allow like this, because the heart has to fill with the blood again to pump. If you keep on pumping like this, what happens? The heart, you are not giving adequate time to heart to fill adequately to pump the blood. If there is no blood, what is the point of pumping too much? That's what you have to give a interruption in between. You have to allow the chest to recoil completely. Then only you have to give next compression.
Only during the recoil is when the blood is filled in the heart, and when you compress, the blood is pushed to the brain. Okay, so we need to allow the recoil and then push it. Okay, so we generally at 100 to 120 compressions per minute is what we have to do. Okay, per minute, generally 60 seconds. So we have to compress at a rate of 100 to 120 per minute, and at a depth of 3 to 4 inches or 4 to 5 centimeters depth we have to go in the adults. Okay, with the heel. Yeah, we will tell you.
We'll discuss afterwards, because it's confusing. Because first time you are many people are listening. If you mix too much, there is great difference will be there. First, we'll discuss about all about the adult one.
And the next most important thing is we're doing CPR. With the CPR, you have to give oxygen also to the patient. Okay, the person who is lying down, you have to always give oxygen also. Okay. అవునండి. So there is one cycle of CPR is in adults. Okay, it is 30 compressions along with 2 breaths. Okay, we have to compress 30 times, go to the head end, open the mouth, take a deep breath, blow. Okay, generally in a common scenario, we give mouth to mouth respiration. But in Western countries and all, they always carry something known as this. There's a face mask that they general public carry. So they will give mouth to mask breaths, but here we don't have those things. So generally we give mouth to mouth respirations only. Okay. So what is the head or the neck position before we give that breaths? Any idea? Yeah. Why do you want to tilt it up? Induku.
I don't remember actually. I just remember the procedure.
So generally what happens is what is the respiratory tract what we have? When we breathe, the air generally goes to the nose to the pharynx, to the larynx, to the trachea. And our respiratory system is inclined in this manner, a C manner. So we want it to be in a straight line so that we blow the air, it directly or majority of the air goes to the lungs. Okay, when it is in a curved fashion, the amount of the air that is reaching lung is less. So we want to make the respiratory tract in a straight line. So that is the only reason we tilt the neck and the chin this way. This is called head tilt and chin lift. With one hand, you hold the forehead, you compress it, and with another hand, you lift the chin. Okay? With the thumb, you open the mouth. Okay? You open the mouth, take a deep breath and blow into the mouth once. And again, you take a deep breath, you open the mouth. Closing the nose, not closing the nose is your comfort at that area. There is no mandatory rule of closing the nose or opening it. Okay? You take a deep breath, head tilt, chin lift and blow. Again you come back to the chest. Again you do 30 compressions. Again you go back to the head end. You give 2 breaths. 32, 32. Unless somebody or the ambulance arrives. Okay? So 30 compressions and 2 breaths. 30 compressions and 2 breaths. Generally in ambulances we have something known as this. This is called AMBU. Okay? Ambulatory breathing unit is called. Okay? This is called ambulatory breathing unit. We have a port here to connect the oxygen. We keep it this way, covering both nose and the mouth, and we compress it, giving breaths. This is all when we get a help from the ambulance. Okay, so before that it is mandatory for us to do both chest compressions as well as breaths. Okay, only in case you are suspecting some road traffic accidents or some neck injury, you don't do this manner, because doing this might injure his spinal cord also. So we don't do. In those conditions, we keep the neck in a neutralized position and then we give breaths. Okay? Yeah.
Only incident where we will not manipulate is, suppose we witnessed some accident in the road. That patient, there might be possibility that they have a fracture of the neck. If you manipulate the neck too much, what happens is they can injure the cord. That's what spinal cord, and they remain paralyzed for lifelong. That is a condition where if you know the patient had a trauma, that is a condition where you will not manipulate the neck of the patient. Other conditions you can do chin lift and head tilt. Okay, both. What happens when you do this maneuver, your tongue will be pulled little bit away from the posterior part. It will create a space for the air to entry. Okay.
In children, the most common cause of death is because of the respiratory issues, not with the heart. So what we do is we compress 15 times and give 2 breaths. So 15 is to 2, so that we give more breaths. Okay? Pillalaki respiratory difficulties, lung issues valla, oxygenation issues valla, generally they get cardiac arrest. So it's always preferable to give more breaths in children. So we cut down it to half. In adults, we do 30:2 because we want to compress the chest more because heart issues are more. But in children, respiratory issues are more. So you give more breaths. So 15:2 is what we have to do.
ఇప్పుడు పెద్దలకి మీరు గట్టిగా
అవునండి. So depending on the body surface area, you do it with your both the hands, single hand, or with the fingers. మరి చిన్న పిల్లోడు నెలల పిల్లోడు అంటే you just do with fingers. When under 10th or under 16 to 18 years, you do with a single hand.
Same pressure use
Yes. And if the body, if 10th class wala kuda, if he is more body surface area of 60-70 kgs unnarante, you can always go ahead and do with both the hands. Okay.
So total 120 times.
No, see, 120 times is the rate, speed what we are giving, but you have to give 30 compressions only. 30 compressions, 2 breath. 30 compressions, 2 breath. We have to repeat these cycles. Okay?
Yeah. The
Till
next
2
question is
minutes.
that. So far, till how much time you want to do this?
Still help arrives. Or they.
Good. Till the help arrives. Any other answers? ఇంకేమన్నా అలసిపోతాం కదా, generally we get tired of doing things. So unless we are tired, okay? Unless we are tired, unless the help arrives, you need to continuously do. But continuous CPR will help. We have a lot of apparatus in the Western countries for monitoring the CPR also. They keep the apparatus on the chest and do compression so that it will guide us. You're doing a slow CPR, do faster. Or you're doing a super fast CPR, calm down, come on the rate. So the lot of monitoring apparatus also these days coming up.
Chest compression, what is the location where we have to give compression? Sternum, lower part of the sternum. Okay? That is the location. How we have to keep the hands?
this
The heel should touch the lower part of the sternal bone, and the other hand you keep over that and interlock with your fingers. Okay? And how much compressions rate? What is the rate of compression you have to do? 30 compressions, 2 breaths. 30 compressions, 2 breaths. Okay? 30 compressions, 2 breaths is a one cycle. That is considered one time you did 30 compressions and 2 breaths is a one cycle. That we have to give 5 cycles for the patient. What we'll do after 5 cycles? 5 cycles are 2 minutes. Both are, but for your understanding, I am telling 5 cycle. One cycle is 30 compressions, 2 breaths. After every 2 minutes, you have to check the response of the patient, pulse of the patient. If pulse is not there, we have to continue our compressions till the emergency help will arrive.
maximum how many times you can do?
There's no limit.
There is no limit.
గంట అయినా
Because we have to check the response also. Generally to understand, we keep it for 5 cycles or 2 minutes. Okay? You have to do 30 compressions, 2 breaths, 30 compressions, 2 breaths for 2 minutes and go back and check the pulse. Where do we check the pulse?
Near the neck.
Okay? For again,
If the pulse is there, then what?
then we stop
Stop
CPR.
the CPR.
Okay.
You
That
stop
is
the
the end
CPR.
point. If the pulse is there, the patient became responsive, we have to monitor the patient till emergency help will arrive, and you will hand over to the emergency team. They will take forward the patient what has to do next. Either they will transport to the nearby hospital.
Okay, sir.
When we come to know that further pressing is not useful and it's already over, then we come to that point and
Yes, sir. After 30-40 minutes, generally you will get an idea if the person is responding or not. In the meanwhile, you get an ambulance, you connect this device, see there is any heart abnormality, you are giving shocks. After that, also the person is not you cease the efforts.
The maximum time is 30 to 40 minutes.
So no, sir. Generally, we do it till that time. There is no limit. The limit is generally unless we are tired, there is no help, or until the ambulance driver comes.
There is no time limit. If you are exhausted, then we will leave it.
That's all.
Till the point will continue. If some other help will arrive, they will continue. Just monitor them, guide them, like that. And as soon as the emergency arrives, what they have is they have a AEDs, automatic.
very exactly start phone if you show us otherwise it looks like it is an answer.
Yes, sir.
You are not audible, sir.
Very exactly a stun bone.
Sternal bone. You have to palpate, sir. You have to palpate with your hand lower end of the sternal bone.
That is just center part of the chest, sir. Center part of the generally आपको वो lungs के साथ ही रहता है, sir. Bone in the rib cage, it is at the center part. Okay. So yes, please.
There is pulse, but still the patient is unconscious, is not
So,
responding to whatever you
I
say.
will
I'm coming to that point. Okay. So again, we'll come from the beginning. So first step is scene safety. Second is calling for help. Fourth is check pulse. So the pulse is there. When you're checking, the person is lying down. Okay. You're going step by step, and you found in the fourth step that the pulse is there. So what do you do?
wait for help. Continuous constant.
Like, I mean, sprinkling water or slapping on.
Like slapping on the
So generally, manam, if you see in medical terms, the pulse is there, which means the heart is beating, but he is not responding because he might have low oxygen in the body. Okay, we have to provide him oxygen then. There is pulse, but the person is drowsy or unconscious. What we do is we only give breaths. You have to only blow and give breaths. Okay, so unless the help arrives, you have already called, they'll put oxygen mask. But until then, you have to blow the air and give only oxygen. You have to just support him with the oxygen. The pulse is there, you're checking. And one good thing you have to do is you have to open the mouth and see whether there's any obstruction. Sometimes what happens is in children or adults, some choking might happen. Some food particles or something is there in the throat that has choked him, not receiving the oxygen. So you can open the mouth, and what you have not to do is don't try to take out that person with the hand. Okay, మనకు కనిపిస్తుంది విజిబిలిటీలో ఉంది బయటే ఉంది అంటే తీస్తాం కానీ we don't అంటే మన బై ఎక్స్పర్ట్ లా you should not put your hand and do things because that will push it inside more, not coming out. Okay, it will create more danger than solving the issue. So it is very superficial, it is solvable, then you remove it. Otherwise you see some particle, you wait for the help to arrive because under supervision it is removed. Until then, only thing what we do is we provide the breaths. Okay?
Lifting the.
Yeah, you head tilt chin lift chesi, we give only breaths. When an unconscious person is fed with water or food, it goes to the lungs, which is very dangerous. Yes, that is in children.
Choking will come later. Then we will discuss the common emergency. Then
పర్సన్కి యాక్సిడెంట్ అయింది. యాక్సిడెంట్ అయిన తర్వాత చాలా మంది కొంచెం దాహంతో ఉంటారు. వాళ్ళకు వాటర్ వచ్చారు.
సాధారణంగా యాక్సిడెంట్ అయినప్పుడు ఇవ్వకపోతేనే బెటర్ సార్, ఎందుకంటే వీ డోంట్ నో వాట్ ఈస్ గోయింగ్ త్రూ. మనం ఇచ్చామనుకోండి డ్రౌజీగా కాన్షియస్గా ఉన్న వాళ్ళకి ఇచ్చిన ఒక అర్థం, వెన్ ద పర్సన్ ఇస్ డ్రౌజీ మనం ఇస్తే ఏమంటే లంగ్స్లోకి వెళ్ళే ఛాన్సెస్ ఎక్కువ.
when the patient is full, suppose the victim is fully conscious enough to swallow the water, you can give offering the water. The patient is the victim is unconscious or semi-conscious. If you give water, it will go into the lung. There might be chances. That's why we avoid giving water or orally anything till he reaches the hospital. Okay, and we will repeat steps, all steps till so far we discussed.
आपको समझ में आ गया? कुछ सुने? मैं हिंदी में बोल रहा हूँ, मैं इंग्लिश में बोल रहा हूँ, तो आपको confusion हो गया?
అర్థమైందా? అర్థం అవ్వకపోతే అడగండి. అర్థం కాలేదు.
ఒకసారి హిందీలో ఒకసారి చెప్పారండి.
ठीक है, तो पहला हम लोग, आप यहाँ सिक्योरिटी पास खड़े हैं तो किसी को देखिए कि कुछ काम नहीं कर रहा, बंदा हिल रहा नहीं, तो जनरली उनको थोड़ा साइड में लेके जाके देखते हैं कि वो जिंदा है या बात कर रहे हैं, नहीं बात कर रहे हैं. ठीक है, तो पहला वो करना है. उसके बाद सेकंड स्टेप एंडिंग. व्हाट इज द सेकंड स्टेप? So you need to tell him first. So first step is scene safety. Next, check the response. हम लोग उनको यहाँ पे टैप करके पूछते हैं कि भाई ठीक हो, ओके. उसके बाद किसी को बुलाते हैं, आपके बगल में कोई है, आपके सुपरवाइजर को या एम्बुलेंस ड्राइवर को, किसी को आप बुलाएंगे. उसके बाद आप पल्स चेक करेंगे. पल्स यहाँ पे नहीं, यहाँ पे करेंगे. ठीक है, 2 फिंगर्स के साथ चेक करके मैक्सिमम ऑफ 10 सेकेंड्स, 5 सेकेंड में देख के बोलना है कि पल्स है नहीं है. अगर पल्स नहीं है तो हम लोग CPR स्टार्ट करते हैं, लेकिन अब पल्स चेक करें, पल्स है तो हम लोग सिर्फ ऑक्सीजन देंगे उनको. ठीक है, यू अंडरस्टूड एवरीथिंग? Yeah, basically lot of times what happens is there is lot of hesitation in going and helping people because you find somebody on the road, in the traffic or in the airport. You fear that some police might come unnecessarily, why we have to go with the patient to the hospital, legal issues, everything. But our government of India, what it has done is, it has produced a law which is called Good Samaritan's Law, which states in the panic situation when somebody wholeheartedly is trying to save the person, in consensus of saving the life, he has done something, he is not liable to anything. Okay, nor police can arrest you, nor hospitals can stop you. You can bring the patient, give to the hospital, and you can leave. Okay, nobody is bound to anything. Under this law, you can safely tell them and go back. And police are also not liable to ask you anything without your consent. If you are not interested in cooperating, you can leave back saying this. Okay, you need not afraid of coming and helping people. That is the sole motto of this law. Okay, you can come help. Nobody is bound to the law. Okay, you can't be liable. They can't charge you or they can't sue you. Okay, you are free because your intention was to help the person.
Doesn't the point come that you're not a certified CPR?
And that is the only thing, ma'am. This course is for laymen, not for medical people. Okay, professional. So we want to teach you so that basic steps are done. Your intention is to save the life. Other than that, intention mundo, there is no law that can stand between you.
So
Okay.
anybody can do that.
Yes, sir. We want to reach this to majority of people, so that before coming to the hospital, these things can be done. Recently, you have seen Allu Arjun incident also. The police people were not properly trained. If they would have done CPR, the result బాగుంటుందా లేదా అనేది తర్వాత విషయం. But the effort is important. We want to go in a right direction. Results will follow. But the direction of things that caused were not proper. So if they have identified, they have done all these 5 steps, called help before, things would have been definitely different for their family. They would have cherished for life when the boy had his mother back. Okay, we can definitely create that change following these 5 simple steps. Okay, so the first step is scene safety, check for response, call for help, check the central carotid pulse. If the pulse is absent, you do CPR. CPR we do for 5 cycles and check the pulse. If the pulse is not there, we continue. We continue unless we are tired or the ambulance arrives. Okay, and the ambulance generally comes with something, as I told you earlier, is AED, automatic external defibrillator. It has something known as these pads. Okay, these pads, generally there are 2 pads. Okay, one is attached below the right collarbone. Okay, and the second one, it is attached below the left nipple, like this. Okay, one is attached here above the collar, below the collarbone, and the other one below the left nipple. Okay, we attach, we plug in, and we on the device. Okay, it will automatically read the heart rhythm. If it is a shockable rhythm, we go back, it will say giving shock, so you go back and the shock is delivered, and you as soon as the shock is delivered, you resume CPR. Okay, again you resume CPR in the same way. Dominant hand unlocking the undominant hand with the heel of the hand below the sternum, you compress 30:2, 30:2, unless the help arrives. Okay, yes, you can continue the CPR with the pads on.
సార్ ఇప్పుడు షాక్ ఇచ్చిన తర్వాత ఆటోమేటిక్గా మనకి ఎలా తెలుస్తుంది?
అది షాక్ డెలివర్డ్ అని మిషన్ అరుస్తుంది.
అరుస్తారా?
మిషన్ అరుస్తుంది, షాక్ డెలివర్డ్ అని.
మళ్ళీ వెంటనే ఇస్తారా?
ఆ తర్వాత మనం CPR చేస్తాము 2 minutes. దాని తర్వాత మళ్ళీ అది రీడ్ చేస్తుంది 2 minutes. 2 minutes తర్వాత మీరు చేతులు దిగిన అగైన్ ఇట్ విల్ టెల్ us shockable, not shockable. If it is shockable, again it will say shockable rhythm.
Then we have to go there.
Then again you remove the hand from the patient, it will deliver a shock.
Okay.
What is shock?
Ma'am, you doesn't need to know all those things. Okay, it will make you complicated. Okay, I can tell you, you have to be familiar with the ECGs. Okay, so adi manaki on the road not required, it will complicate. Okay, after that the ambulance arrives, you can hand over them, they will there's a doctor available, he sees the ECG. If he has a heart condition, shift the patient to the cath lab. They'll put the stents. Okay? All done? Suppose, yes, please.
Like, because it's a panic situation, is it safe to say that it's more important to act fast and just follow these guidelines than to just be very particular about what exactly we're doing? Like, basically, these techniques we have to understand and all that, but exact custom the exact just anta particular undala.
Particularly undala andukane ee session.
Maybe learning here, but in panic situation,
Practical.
So అందుకనే that's why I told you, go back home, discuss with your friends so that you will be particular. మీరు ఎంతమందితో డిస్కస్ చేస్తే అన్నిసార్లు మీకు గుర్తుంటుంది. మీరు ఎన్నిసార్లు ప్రాక్టీస్ చేస్తే పానిక్ సిచ్యువేషన్ అంత ఈజీ అవుతుంది. ఓకే, డిస్కస్ విత్ మోర్ పీపుల్, హ్యావ్ మోర్ సెషన్స్, డూ ఇట్. సార్ ఎక్విప్మెంట్ ఎప్పుడంటే అప్పుడు తెప్పిస్తారు మీకు, యూ హ్యావ్ సార్ అవైలబుల్. సో యూ లెర్న్ ఇట్ మోర్ ఫ్రీక్వెంట్లీ అండ్ మోర్ ఈజియర్.
So we'll conduct every.
So ఇప్పుడు కూడా once I finish, please come voluntarily, do us, show us, so that we'll tell you what more you can do, how properly you can do. Okay? At the end of the day, we are all here to save lives. Okay?
This AD part is not that relevant to us because that will be
Is that-
No, it's okay, sir.
that is
It's
not
okay.
with us, and that is not much relevant.
No. Even I think, sorry to interrupt you, AD is for the basic persons. It is actually designed for the basic persons, non-medical persons. It would be a small machine available anywhere, like your airports.
No, but we don't carry that with us.
You need not carry. No. This is installed in a public places. Like, for example, someone crashed in a hotel. It's a big hotel, maybe in an airport. You need to search. There will be arrow. Where is the AD? Okay, there you go. Bring that one and attach it.
Okay.
We never carry. Those are what defibrillators. Those are personal ones. This is for a common purpose.
So there are a lot of provisions where we are installing it everywhere, sir.
Where it is available. then
Yes.
we will
In
operate.
the community also, you need to have some place for this. In emergency, you communicate and go
Google
there.
help desk. ఎప్పుడైనా ఎమర్జెన్సీలో హెల్ప్ డెస్క్ ఫోన్ చేస్తే సిచ్యువేషన్ బట్టి will act.
అట్లా చాలా చోట్ల
AEDs are little costly. At this point, it's cost around 2 to 3 lakhs AED devices. Western countries, what they will do in public places they will install whenever help required. They will get from the public place and they will get back. You need to understand what is arrhythmia, what you are telling is shockable rhythm, non-shockable rhythm. That basically you don't need to understand. This is the devices where it will automatically detect. Okay, these algorithms are placed inside. When it is shockable, whatever rhythms are there, according to the algorithm, it will work. Whenever shockable rhythm is there, it will give shock. It will deliver shock. Otherwise, it will tell not to deliver the shock. Okay, it will guide us, the laypersons. Okay, basically to understanding for you what is shockable rhythm. What happens normally, our heart contracts at a rate of 60 to 100 beats per minute, depending upon the patient metabolic activity. Suppose you are resting, your heart is come down. You are doing vigorous exercise, your heart will beat at a higher rate. According to the demand of the body, it will work. Normally, the heart will contract like this. Okay, it is a normal rhythm. What happens when you have a heart attack or any other thing? The heart muscles will, the rhythm disturbance will come because of normally this has to come. The heart will contract like this. It will not pump blood at all outside of the heart. That is the rhythm. You have to deliver a shock and you have to terminate the shock so that the normal pulse will come in a regular fashion. That's what these AED devices are designed for, to terminate this kind of fibrillation. It is called as. It is a suddenly within seconds the patient become unconscious when this kind of contractions will happen. That is the reason we have to have AED, which will help us to automatically, we have integrated algorithms. It will tell when to deliver, when to not deliver a shock.
Can you repeat the 5 steps one last time, please? I'll not bore you again. Okay, seal safety. Okay, you have done you have opened the chest, exposed doing CPR, and you suddenly found there is some electric activity or device here. అంటే కొంతమందికి మనము ICDs అని పెడతారు. ఓకే, హార్ట్ డిఫికల్టీస్ వల్ల there is a something ICD which is placed on the chest. So what do? You want to do the CPR or not? So it might get shocked. So what do you want to do? You want to do CPR, not do CPR? వాట్ యూ వాంట్ టు డూ?
It's only three.
మీరు సిపిఆర్ తీద్దాం అన్నారు, తీయంగానే అక్కడ డివైస్ కనిపించింది మీకు. సో యూ వాంట్ టు డూ, నాట్ డూ.
Only three.
మరి పల్స్ లేదు కదా, మరి బ్రీతింగ్ ఇస్తే ఎట్లా? సో వాట్ యూ వాంట్ టు డూ సార్?
Know what this device is.
You don't have the time, ma'am,
Yeah.
to see what is the device. So basically, this session is for that. Whatever happens, you have to do CPR. Okay? We have to save him, so nothing is coming in between us and CPR. Okay? Whatever is coming in between us and CPR, you have to compress it by doing CPR. Okay? You have to compress it and do it. Okay? మధ్యలో కొన్ని రిబ్స్ ఫ్రాక్చర్ అయినా, యూ షుడ్ నాట్ థింక్ ఆల్ దోస్ థింగ్స్. యూ హ్యావ్ టు కంప్రెస్ అండ్ పుష్ ద బ్లడ్ ఫాస్టర్ టు ద బ్రెయిన్. ఓకే?
So 60-70 years same. Adult for all same.
So let us take some other scenario. So you have seen somebody having a blood vomiting and suddenly he went unconscious.
Same.
What do you want to do? You want to blow?
CPR.
CPR సరే, నోట్ తెచ్చి గాలి ఇవ్వాలి కదా. You want to provide breaths. There is full blood. What do you want to do? You want to blow? You want to stop only CPR? ఏం చేద్దాం? ముక్కులో చూస్తారా? So what do you want to do?
Pulse is not there, you have to be very
Yes sir. So how do you want to do when there is some blood?
See sorry to interrupt that. So the whole point is maintenance of the blood flow to the brain and heart. Okay. So between your breathing and the compressions are the most important thing. End of the whole whatever the talk and whatever you practice now, your point is to identify an unresponsive person. Suddenly someone becomes unresponsive. Okay, don't go and jump on someone who's sleeping. Many people do that in movies you see, no? They'll be sitting and they'll be doing all those things. So identify a person who's unresponsive. That's what I think Sir has told. Properly see the pulse. If you're unable to see the pulse, is not responding, don't delay the chest compression. So the whole point, everything is knowing where to do the compression, how fast you need to do without stopping, and how deep you need to do. And you need to have someone beside you to take over. And in your place, you need to have some helpline so that some other help will come surrounding ambulance, something. That is the whole point in teaching you. Nowadays, this is called as compression only CPR. Okay, many of the times like the setting, no, they may have a bleeding, they may have secretions. We are not really clear whether to do a mouth-to-mouth breathing. Now, most of the CPRs, we are leaving about the mouth-to-mouth. Between the compressions and the mouth-to-mouth breathing, compression is the most important. 80% of the survival is because of the compression. So don't leave the compression just for the sake of that fancy mouth-to-mouth breathing. You can leave it, but don't delay the compression. Understood?
Okay. So majority of you if it is superficial blood, you clean it with some tissue or the clothes you have and do it. If you are unable to do it, it's always preferable to continue compressions. Okay. So if there is some people undergo bypass surgery, there are some stitches. You should not think of all those things while doing CPR, because he might have stitches in the central part of the chest where you have to compress, but still you have to compress and do CPR. Okay? Yes, Chabu.
సార్ ఇప్పుడు మీరు చెప్పారు నోట్లో బ్లడ్ బయటకు వస్తుందని చెప్పేసి, సో క్లీన్ చేస్తాం మళ్ళీ మౌత్ టు మౌత్ ఇస్తున్నాం. ఇన్ కేస్ ఫర్ ఎగ్జాంపుల్ ఇప్పుడు క్యాన్సర్స్ ఇవన్నీ అంటే ఇప్పుడు బ్లడ్లో అది మనలోకి వెళ్తే అన్ఫార్చునేట్లీ మనలోకి ఆ బ్లడ్
If
వెళ్తే
you have it down, clear it.
అందుకనే
Chest compression. That's what.
మనకేమైనా లోకి వెళ్తే బ్లడ్ మనకేమైనా ప్రాబ్లం?
ఏముండదు సార్, మనం అంత డౌట్ లో ఉన్నప్పుడు స్టాప్ అండ్ కంటిన్యూ ద చెస్ట్ కంప్రెషన్స్.
Don't do it if you don't know. Don't do it.
So
అంటే దానివల్ల ప్రాబ్లం అయితే ఉంటుందా?
We don't know. Most of the time will not be there.
Hmm,
We don't
majority
know.
of
If you
times
have a
it does.
doubt, instead of wasting that, do the good compression.
ఇన్ కేస్ ఒకవేళ పర్సన్ కి మనకు తెలియదు కానీ పర్సన్ కి ఏదో ప్రాబ్లం క్యాన్సర్ అయినా ఏదో సంథింగ్ ఉంది,
Cancer will not spread like that. Okay, infections are something which you are afraid that we don't know. But honestly, yeah, cancer will not spread with your mouth to mouth, blood to blood. It will not spread like that. It is something.
అది రాదు సార్.
ఇప్పుడు హెచ్ఐవి అనేది ఇప్పుడు మనకి ఉన్నప్పుడు
HIV is an infection.
అది బ్లడ్ టు బ్లడ్ నోట్లో.
Yes, it will be. That's the reason. If you have a doubt of infections, how common is it? Usually the setting is you're in some crowd, some middle-aged gentleman, someone suddenly they'll have a chest pain, they collapse. It's not an infective scenario, right? So unlikely. Okay, but if you have any suspicion, leave about the mouth to mouth. It's only 10%, 20%. Concentrate on the proper CPR. It saves a life, right?
So let us try and do CPR.
Especially the floating.
If you have trained yourself properly, I think less chance, but there may be a small chance. But if you're saving a life, between the risk and benefit, the benefit is always better.
No, basically you have to see, you should not hurt yourself. Wrong CPR will hurt you more than patient. Okay, you will get tired. Wrong doing of CPR, that will not be effective. Which is not doing also is almost the same. Okay, so that is the reason why we are telling you to come practice on the mannequin so that you do it properly. Okay. Some common emergencies also. ఒకవేళ మనకి in the community somewhere you find some chest pains, heart attack ఎలా గుర్తుపడతారు? Any idea how do you identify
Sweating.
what are the common symptoms by
Sweat. And చెయ్యి సడన్ గా లాగడం.
Majority of times the people will have left side chest pain radiating to the arm. అంటే ఇది ఒకటేనా అంటే ఇది ఒకటే కాదు, lot of other symptoms, but the cardinal symptom is having a left side chest pain radiating to the arm. And కొంతమందికి ఆయాసం వస్తుంటుంది, a lot of people having breathing difficulties, lot of sweating will happen. Then what you advise is to go to the nearest hospital, take an ECG, and ఒకవేళ వాళ్ళకి బీపీ కానీ షుగర్ కానీ లాంగ్ స్టాండింగ్ ఉన్నాయి, దే ఆర్ స్మోకర్స్ ఆర్ టొబాకో చూవర్స్, all risk factors ఉన్నప్పుడు you always advise them to go to the nearest hospital faster, take an ECG and get the medical help. Okay, you have to identify these symptoms like మెట్లు ఎక్కుతున్నప్పుడు ఆయాసం వస్తుంది, ఆయనకి తొందరగా అలసిపోతున్నారా, లేకపోతే చెమటలు పడుతున్నాయి, మిడిల్ ఏజ్ మెన్ హ్యావింగ్ డయాబెటీస్, హైపర్ టెన్సివ్ ఫర్ లాంగ్ స్టాండింగ్, హ్యావింగ్ చెస్ట్ పెయిన్. అదే లెఫ్ట్ సైడ్ ఉన్నాయి కదా, రైట్ సైడ్ వచ్చిన, అప్పర్ బ్యాక్ వచ్చిన, సమ్ టైమ్స్ దీస్ పీపుల్ ఆర్ గెటింగ్ జా పెయిన్స్ ఆల్సో. సో దేర్ ఆర్ లాట్ ఆఫ్ పీపుల్ కమింగ్ విత్ జా పెయిన్స్, identifying as MI. Okay, so any suspicion or doubt, go to the nearest medical help. Okay, ఒకవేళ బ్రెయిన్ స్ట్రోక్ అనుకోండి, how do you identify brain stroke? కామన్ సినిమాలో చూపించినట్టు మనకి what are the typical symptoms they have?
Talking, difficulty talking.
అంతేనండి, అంటే ఒకవేళ if they are unable to lift their hands or unable to walk, they are swaying while walking and falling down, mouth moving to one side of the part, right side or left side deviation of the mouth. Okay, unable to open the one of the eye. Okay, unable to hold cups or glasses, లేదా సడన్ గా వచ్చి కింద పడిపోయి ఫిట్స్ వస్తున్నాయి అనుకున్నప్పుడు, there are a lot of all these things. You identify them, take to the nearest hospital again. Okay.
Sir, heart stroke వచ్చి అలా పడిపోయినప్పుడు emergency there are some series of medicines which you can carry before you go.
Yes, ma'am.
Pain వచ్చి వెళ్ళే అంతవరకు time
See,
ఉంటుందా?
if the patient having active chest pain, the first thing we can give is sorbitrate sublingual. If you are at least you are thinking of cardiac, you can keep a 5 mg of sorbitrate under the tongue before you reach the hospital. There is no harm in doing that. Many of the patient we can use. We suppose the patient who is having previous cardiac history, we suggest to carry a sorbitrate tablet within the pocket. If they had any chest pain, in the meantime he reached the hospital, we advise to take a sorbitrate tablet. Okay, and try to make him console the patient not to become anxious and take the rest maximum as possible, because usually the physical activity or anything will aggravate the pain. Taking the rest will heart rate will come down and the chest pain also will come down. Okay.
Sometimes chest
ఆయన
pain.
చెప్పారు కదా, ఫ్రంట్ టు బ్యాక్ అని రావచ్చు.
There can be a wide variety of symptoms the patient can have. Okay, like chest pain, they can have radiation to the left associated with sweating, they can have breathlessness with minimal physical activity, and sometimes they have neck pain extending till jaw, they have back pain, sometimes abdominal symptoms, they have abdominal pain. Even if the patient is at risk, even with the abdominal pain also, sometimes atypical pain called as we have to rule out the cardiac as a cause. Okay, we have to, because that have specific treatment. Other, if this abdominal pain, we can leave it out. But why it is important is recognition, because if you identify the patient with a heart attack immediately, there is a we can push him to the cath lab, means where we can open. What happens is heart attack when the blood vessel where supply to the heart, like blood supplies heart to the whole body, but it also requires energy to contact. It has its own blood supply. Blood vessels. When any of the blood supply vessels got clogged, the patient will have a heart attack. If you open up within a 2 hours of time, the reversibility of the damage will be much less compared to that of if you don't open it. Because if you open it, the damage will be much lesser compared to that of not opening it. That's what we have to rush to the hospital, and we have to rule out the cardiac problem. Okay. And other thing is a brain stroke. Here, brain stroke, there could be two types. Again, called ischemic and hemorrhagic. What happens is the blood supply, the vessels supplying the brain get clogged. We have ischemic stroke because of low blood supply, and we have a hemorrhagic stroke where, because of the high blood pressure, your blood vessels got burst and there is bleeding happened within the brain. Okay, what could be the symptoms is usually the patient have a headache, or suppose they have suddenly the patient had a hand weakness, leg weakness, unable to stand. This kind of symptom, they are facial droop, slurring of speech. Suddenly, all of a sudden the patient speaking and suddenly they have a deviation of mouth. These are the symptoms we have to identify when the patient have a stroke. And if immediately we have a rush to the hospital, because if early they give the treatment, the chances of damage, irreversible damage, will be much less. Because in ischemic stroke, suppose there is a clot, if you reach the hospital within the 4 hours, if you we give some clot dissolving medicine, where we land up without any damage. If it is beyond 4 hours, the damage will be irreversible and the weakness will persist for the lifelong for the patient. Okay, that is the point where recognition is important and timely seeking for the help is important.
ఇది జెంట్స్ లేడీస్ కి ఇద్దరికి
Same. BLS is for any person. Adult.
Irrespective of genders.
And seizures. What is meant by fits? You see somebody is falling suddenly and having jerky movements. It is a basically disturbance within the brain, electrical disturbance within the brain, which manifests as a fits, which is a jerky movements of the body, and the patient remain unconscious, and there is a frothing, it's a bubbling from the mouth, and they have passing urine involuntarily, passing motion. These are all variety of symptoms they have. What is the immediate threat to that patient who is scissoring is, they can have a vomiting and they can have aspiration, means they will aspirate into the lung. Suddenly the oxygen levels will go down. That's what is the primary thing we have to do. Usually we see in movies some metallic thing we will keep. But that is not a medically proven thing. What the first thing is, they usually involuntarily bite their tongue, the lip, everything. If at all possible, we try to keep some hard thing between the teeth, if possible, because sometimes the patient will clench very hardly. They will damage. Never try to keep your fingers or something because they will bite involuntarily. The other thing is you have to roll the patient over the side, so that anything vomits or something happens to the patient, it will come out rather than going inside. Okay, and once the seizure terminates, it will be remain unconscious for some time. You have to call for the help till the emergency. You have to do just whatever I told you. These two things are important before the emergency help arrives.
ఇప్పుడు ఫిట్స్ వచ్చిన పర్సన్ లాస్ట్ టైం అంటే ఒకసారి నేను చూసాను, కింద పడిపోయాడు. దాన్ని అన్ఫార్చునేట్లీ తను హెడ్ని ఎక్కువ మూమెంట్స్ ఇచ్చినప్పుడు అంతా రాయి తగిలి మేము వచ్చేలోపే ఇంజురీ అనేది హెడ్ కూడా అయిపోయింది అన్ఫార్చునేట్లీ. అలాంటి పర్సన్ పడుకోబెట్టే ఉంచాలా లేకపోతే కూర్చోబెట్టచ్చు?
You have to turn to the side of the patient, and if possible, whatever you are telling, the rapid movement should be hold the patient till the fit activity subsides.
కూర్చోబెట్టు.
సాధారణంగా we always try to turn the patient to the left lateral decubitus. The left side తిప్పుతాం అన్నమాట పేషెంట్ ప్రిఫరబుల్లీ, బికాస్ రైట్ సైడ్ ఆస్పిరేషన్ ఛాన్సెస్ ఎక్కువ, లెఫ్ట్ సైడ్ తక్కువ. సో మనకి ఏమైనా నొరుగు వచ్చినప్పుడు అది లంగ్స్లోకి వెళ్ళిపోయే ఛాన్స్ ఉంటుంది అనమాట. సో అందుకని రైట్ సైడ్ పడుకోబెడితే తొందరగా వెళ్ళిపోతాయి. సో వీ ఆల్వేస్ ట్రై టు టర్న్ ద పర్సన్ టు ద లెఫ్ట్ సైడ్ అండ్ హోల్డ్ హిమ్ అన్లెస్ ది సీజర్స్ ఆర్ స్టాప్. ఓకే. సో సాధారణంగా ఫ్రాక్చర్స్కి ఏం చేస్తారు? ఎవరికైనా బ్లీడింగ్ ఆర్ సడన్గా బోన్స్ ఆడుతూ కింద పడిపోయారు అనుకోండి, వాట్ యూ వాంట్ టు డూ? విల్ వైండ్ ఇట్ అండ్ విల్ స్టార్ట్ ది హ్యాండ్స్ ఆన్. సాధారణంగా ఏం చేస్తాం మనం? ఫ్రాక్చర్స్ ఏమైనా ఉంటే పిల్లలు కింద పడిపోతుంటారు, సో వాపు వస్తుంది. వాట్ యూ వాంట్ టు డూ విత్ దెమ్? బాగా చెప్పేసారు. డాక్టర్ తీసుకెళ్దాం, తీసుకెళ్ళేదానికి ఏం చేద్దామని. సో జనరలీ వాట్ వి అడ్వైజ్ ఇస్ టు రెస్ట్ దట్ లిప్. ఓకే. ఎస్ మ్యామ్. ఐస్ ప్యాకింగ్, ఇమ్మొబిలైజేషన్ అండ్ రెస్ట్. ఓకే. చేతికి తగిలితే వి స్టాప్ మొబిలైజింగ్ ఇట్, అంటే దాన్ని ఊపడమో చేతిని కాపేసి వి ట్రై టు రెస్ట్. ఐస్ ప్యాక్ అప్లై చేస్తాం, వి గో టు ద నియరెస్ట్ సెంటర్. ఓకే. సో ఇఫ్ యూ కెన్ కమ్ అండ్ ప్రాక్టీస్, వీ హ్యావ్ 2 mannequins here. ఓకే. ప్లీజ్ కమ్. హ్యాండ్స్ ఆన్ చేస్తే విల్ ట్రై.
If it is not doing any response, then we check the pulse. Pulse check చేస్తాం. Pulse check చేసి
ఎక్కడ చెక్ చేస్తున్నారు?
దీనికి సైడ్
This side is more easier.
ఎందుకు I'm on this side.
You're on this side, so reaching this is more faster కదా.
whatever if you feel that
గురువు ఉంటుంది సార్, ఇక్కడ సెంటర్ గురువు ఉంటుంది, మధ్యలో పాల్పెట్ చేయాలి.
then
ఇట్ సైడ్ ఫింగర్ నియర్
పొజిషన్ ఎక్కడ?
and you see the respiration simultaneously. Whether the patient is breathing or not.
Hard.
Just
Just try చూసుకుంటాం.
it has to be limited to
what
10
are the
seconds.
position if you feel right hand or right?
Response
So
లేదు.
there is no pulse. So next
Straight hands.
you do CPR. Yes.
Thirty times.
So first stabilize your first stabilize చేసుకొని
30 times చెయ్యి.
You have to, okay, you have count louder. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25.
come back and do this. ఎందుకంటే అక్కడ కైయస్ లో మనం ఇన్స్టాల్ చేస్తామో తెలియదు.
Okay, 30 times. That's the delivered. Again, you have to do
So
computer.
you can only elbows bend చేస్తున్నారు. Yes.
Worry about the mobility.
From elbows bend అవుతుంది ఇంకా.
Breathing అవసరం లేదు.
Yeah.
Between
ఎల్బోస్ బెండ్ అవ్వకూడదు, మీకు ప్రెషర్ అలసిపోతారు మీరు బేసికల్లీ. ఎల్బోస్ బెండ్ అవుతాయి. సో అందుకని యాజ్ స్ట్రైట్ యాజ్ పాసిబుల్.
Count loudly.
5, 6,
So now
7,
repeat
8,
the
9,
scenario.
10, 11,
First
12,
step.
13, 14, 15, 16, 17, 18, 19,
Okay, first choose a
22,
person.
23, 24, 25, 26, 27,
Okay,
28,
choose a
29,
person.
30.
తీసుకొని వచ్చాం. Then
Again, you forget to call the you forget to call the
then this is the place. Collarbone.
Deep breathing is called first.
After this,
మళ్ళా చూడాలి.
then check the pulse.
5 seconds. 5 times చేస్తారు, then they have to
2
check
inches.
the pulse.
That is the last heart connected pulse. This is the last pulse. Okay. After this, we'll check this. This is the last pulse. It is connected to our heart. Okay. If it is not working, call for the help. Then between the two nipples,
టేక్ ఎ డీప్ బ్రెత్ అండ్ గివ్ నౌ.
ఇలా ఇంకొక side.
then this
Two
times
అండ్
blow.
CPR మీరు రిక్వైరింగ్ టైం ఇవ్వాలి. మీరు ఎంత ఫాస్ట్ గా చేస్తున్నారంటే హార్ట్ రిక్వైర్ అవ్వట్లేదు.
Okay.
నేను చేసి చూపించిన 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
Compression started. 5 times చేస్తారు.
So you have to take deep breath and give. Compress చేసినప్పుడు పైకి వచ్చేసరికి కూడా ఇవ్వాలి.
Okay. Instead of relax.
Yes, sir.
tough.
అలానే కొంచెం ఫాస్ట్ చేయండి. అలానే
నిజంగా హార్ట్ అటాక్ నాకు వస్తుంది. నేను హార్ట్ అటాక్ తెచ్చుకున్న సిపిఆర్ నాకు వద్దు సార్.
Yeah, second we need to check for any response. Are you okay?
आजा ओपी जिम्मे सर.
Are you okay?
No response.
Then we need to check response. Call for help.
Call your phone.
We will call for help.
Sir, step
Somebody
one,
call
step
the
one.
ambulance.
Anybody use this call for help. Somebody arrives, you tell them to activate the emergency system, you continue with the patient. If that is not there, you have to call, activate the emergency, then you have to continue the rest. Next.
और क्या करते हैं?
You have to check the pulse like this. If you check like that, the chance of failing will be like this. We are concentrating at single point like this. Like this is very good.
देखा करो వీళ్ళ చేయబోయే the fraction of seconds matters at that point of time. So this is more easier.
No pulse.
చేయబడితే మీకు దొరికేస్తుంది. Okay, there is no pulse. How to do CPR?
Count the loudly number by number. How many compressions you are doing? Don't take off the hand from the patient. Leave it, but you allow the recall.
Yeah. Waiting for the reply. Okay, don't leave the.
Elbows bend చేయకండి సార్. Correct sir, change.
3, 4, 5, 6, 7,
22, 23, 24, 25, 26, 27, 28, 29, 30. Come on sir, again compressions. Eighteen, 19, 20, 21, 22, 23, 24, 30. So next.
pressure 5 centimeter.
Second.
5 centimeter अंदर जाना है. अब मान लो ये 1 पूरा चेस्ट है हमारा, इसमें 1
Sir Mohan sir.
అది ఇక్కడ పెట్టాలి. కాలర్ బోన్ దగ్గర రెండు పక్కల. ఎస్
అంకుల్ ఉన్నారా? దాని తర్వాత మనం పల్స్ చెక్ చేస్తాం. ఆయన పలకట్లేదు అనుకో, ఒక చేత్తో ఇది తీసేయి.
అది పల్స్ చెక్ చేయట్లేదు, దగ్గర ఒక్కేస్తుంది.
ఇప్పుడు సిపిఆర్ ఇక్కడ పెట్టి చెక్ ఇప్పుడు చేయి కలపకూడదు, చేయి కలపకుండా ఇక్కడే పెట్టి ఈ చేయి తీయకూడదు. ఒకసారి పెట్టాయి ఇక్కడ 8, 9, 10, 11, 12, 13, 14, 15. ఇప్పుడు ఊదు.
ఎలా ఉన్నారు ఎలా ఉన్నారు మూడు సార్లు రెస్పాన్స్ ఏం లేదు పేషెంట్. నెక్స్ట్ ఏం చేస్తారు? పల్స్ ఉందో లేదు చెక్ చేయాలి. పల్స్ మీకు పెట్టుకోండి తెలుస్తుందా? అట్లా పేషెంట్ ఉండాలి. ఒకవేళ లేదు అది కూడా పల్స్. నెక్స్ట్ ఏం చేస్తారు?
మనం షిఫ్ట్ చేస్తాం.
సిపిఆర్ చేయాలి. చేయండి. ఎలా పెడతారు? హ్యాండ్ పెట్టండి. రైట్ హ్యాండ్ లెఫ్ట్ హ్యాండ్? రైట్ హ్యాండ్. రైట్ హ్యాండ్ పెట్టండి ఫస్ట్. ఇది ఒకటే అనాలి, ఈ భాగం ఒకటే అనాలి. కంప్రెస్ చేయండి 30 సార్లు గట్టిగా అనండి. నెంబర్ లెక్క పెట్టి 1, 2, 3.
పల్స్ చెక్ చేసి పల్స్ లేకపోతే
CPR.
థ్యాంక్ యూ సో మచ్. అందరూ చాలా వచ్చారు, చాలా కొత్త కొత్త విషయాలు. Till now, we all used to watch YouTube shorts, YouTube videos, and used to learn how to do it. But today is the day we learn what exactly CPR is. Okay? So అందు గురించి మనకి ఇంత నాలెడ్జ్ ఇచ్చిన ఈ పర్టికులర్ డాక్టర్స్ గ్రూప్ ఏదైతే ఉన్నారో we have to thank, and థ్యాంక్స్ అనేది నార్మల్గా నోట్తో చెప్తే కాదండి. ఓకే, సో వాళ్ళకి మన తరఫున వాళ్ళకి ప్లాంట్స్ని, ఆక్సిజన్ ఇచ్చే ప్లాంట్స్ని వాళ్ళకి ఇస్తూ థ్యాంక్స్ చెప్పుకుందాం. సో ఐ రిక్వెస్ట్, ఓకే, మోహన్ గారు, స్వాతి అండ్ ఎంకే గుప్తా, నవీన్ గారు, ఎవ్రీబడి, మంజునాథ్ గారు, ప్లీజ్ కమ్ అండ్ ప్లీజ్ గివ్ దమ్ అండ్ sir, please. So I request Gupta sir.
Sir, they joined little late. He is a secretary of the ISCCM and he is a consultant critical care medicine and a professor of medicine in Apollo Jubilee Hills. Thank you sir for coming.
So even valuable suggestions from
So I request Gupta sir, please. Okay, so మనం రెస్పెక్ట్ చేసుకోవడం చాలా ఇంపార్టెంట్ అండి. థ్యాంక్ యూ సో మచ్ సార్, థ్యాంక్ యూ సో మచ్ ఫర్ యువర్ వాల్యుబుల్ టైం. బికాస్ ఈ రోజుల్లో ప్రతి సాఫ్ట్వేర్, ఎనీథింగ్ యూ చూస్ ఎనీథింగ్, వన్ డే అనేది లీవ్ ఉంటుంది. సో వెదర్ ఇట్ ఈస్ సాటర్డే ఆర్ సండే విల్ హ్యావ్ లీవ్. బట్ ద 2 పొజిషన్స్ ఇద్దరికి మాత్రం లీవ్ ఉండదు, ఒకటి పోలీసులకి, ఇంకోటి డాక్టర్స్కి అండ్ సైనికులకి. ఓకేనా, we must thank to our guys who is securing us. మనలందరినీ కాపాడుతున్న సైనికులకి చాలా థ్యాంక్ యూ. అండ్ వాళ్ళు బోర్డర్ బయట కాపాడుతూ మన బయట కాపాడుతున్నారు, మన రోగాలను కాపాడుతున్న డాక్టర్స్ కూడా థ్యాంక్ యూ సో మచ్. అండ్ నా వాళ్ళ రిక్వెస్ట్ కంటిన్యూ టు ప్లీజ్. థ్యాంక్ యూ సో మచ్. అండ్ నా రిక్వెస్ట్ మోహన్ గారు, so yeah, thank you so much. ఇది కేవలం వాళ్ళకి ఇచ్చే మన ఒక థ్యాంక్స్ కాదండి. ఓకే, సో దిస్ ఇస్ వెరీ వాల్యుబుల్ ఇన్ఫర్మేషన్ మనకి వాళ్ళు చాలా ఇచ్చారు. ఇప్పటి వరకు మనం వీడియోస్లోని, యూట్యూబ్లో, మూవీస్లో వాళ్ళ ఇచ్చిన బేసిక్ ఇన్ఫర్మేషన్ తీసుకుని మనకు అంతా తెలుసు, సిపిఆర్ అంటే ఏంటో తెలుసు. బట్ ఆఫ్టర్ వాట్ ఎగ్జాక్ట్లీ సిపిఆర్ అంటే ఏంటో తెలిసిన తర్వాత అర్థమైంది ఏంటంటే మనకేం తెలియదు. సో మనకి తెలియని ఇన్ఫర్మేషన్ని ఇంత చక్కగా చేసి లైవ్గా, ఐ మీన్ నాట్ లైవ్, ఒక డెమోన్స్ట్రేట్ ఇచ్చేసి ఇంత నీట్గా మనకు ఎక్స్ప్లెయిన్ చేసిన డాక్టర్స్ అండ్ టీమ్ అండ్ అందరికీ పేరు పేరున బ్రిగేడ్ సింగ్ తరఫున, ఓకే, వాళ్ళందరికీ వెరీ వెరీ థ్యాంక్స్. So much for this time, valuable time. As I said, వాళ్ళకి సండే సాటర్డే ఏమి ఉండవండి, 365 days. ఓకే, సో అలాగా వాళ్ళు కూడా కోరుకుంటుంది ఏంటంటే దే షుడ్ గెట్ లీవ్ 1 or 2 days అలా వస్తాయి. అది ఎప్పుడో జరుగుతుంది అంటే ఇఫ్ ఎవ్రీబడి ఈజ్ అవేర్ ఆఫ్ దిస్ కైండ్ ఆఫ్ ప్రాసెస్, వాళ్ళకు కూడా టైం దొరుకుతుంది. కొన్ని జబ్బులు తగ్గాలి, మనం హెల్తీగా ఉంటేనే వాళ్ళకు కూడా ఓకే లీవ్స్ అన్ని దొరుకుతాయి. సో కొంచెం హెల్త్ మీద కేర్ తీసుకొని ఓకే అందరూ కూడా హ్యాపీగా ఉండాలని కోరుకుంటూ థ్యాంక్ యూ సో మచ్ ఆల్ ద 3 డాక్టర్స్ ఫర్ కమింగ్ అండ్ డెమోన్స్ట్రేట్ ఆల్ ద ప్రొసీజర్. అండ్ థ్యాంక్ యూ సో మచ్ ఫర్ ఆడియన్స్ ఇంత ఇంట్రెస్టెడ్ గా వచ్చి మీ యొక్క టైం స్పెండ్ చేసినందుకు థ్యాంక్ యూ సో మచ్. అండ్ స్పెషల్ థ్యాంక్స్ టు అవర్ ఆర్గనైజర్స్, ఓకే, Mohan garu, Swati garu, and Manjuna, Sankanavi, all the team, and వీళ్ళకి చాలా చాలా థ్యాంక్స్ అండి. సో ఇలాంటి ప్రోగ్రామ్స్ అట్లీస్ట్ మంత్లీ ఒకసారి జరగాలి. బికాస్ ఇప్పుడు వచ్చింది 10 మంది, ఒక 20 మంది, ఒక 30 మంది వచ్చారు, ఇంకా 1300 మంది ఉన్నారు. ఇది ఎలాగైతే ఒక లైబ్రరీ అనేది జరిగిందో గ్రాండ్గా, ఓకేనా, అలాంటి ఒక ఏమంటారు ఒక విఐపి వస్తే తప్ప అతన్ని చూడడానికైనా వచ్చి ఇలాంటి బేసిక్ ఇన్ఫర్మేషన్ తీసుకుంటారు. ఓకే, ఇప్పుడు డాక్టర్స్ అనేది ఎప్పుడు కూడా విఐపీనే, కానీ ఒక నోన్ పర్సన్స్ ఉంటే దానికి ఇంకా క్రేజ్ వస్తుంది అన్నట్టు. సో అలాంటి క్రేజ్ మనకు కావాలండి. ఇది ఇది ఇప్పుడు ఇక్కడ ఏదైతే జరిగిందో అది మన యాంపీ థియేటర్ దగ్గర ఆల్మోస్ట్ మినిమం ఒక 300 మంది ఉన్నప్పుడు జరిగితే ఇన్ఫర్మేషన్ అనేది కొంచెం హెల్తీగా ఇంకా బెటర్గా వెళ్తుందని నా ఉద్దేశం.
ఫస్ట్ సెషన్ ఇది నార్మల్ ప్రాక్టీస్ కోసం చేసింది. నెక్స్ట్ మనము విత్ ఇన్ 1 month యాంపీ థియేటర్ దగ్గర ఎక్కువ క్రౌడ్ తో దీన్ని చేసి అందరికీ అవేర్నెస్ క్రియేట్ చేయడం ట్రై చేస్తాం. సజెస్టెడ్ బై శ్రీనివాస్ గారు. అండ్ స్పెషల్ థ్యాంక్స్ టు దినేష్ గారు. దినేష్ గారు ఒక 20 days నుంచి ఆయన అడుగుతున్నాను. ఆయన అన్ని పనులు మానుకొని మన కోసం సండే ఆయన టైం స్పేర్ చేసి మన కోసం ఇది అరేంజ్ చేశారు. సో థ్యాంక్ యూ దినేష్ గారు. అండ్ ఫెలో డాక్టర్స్, ఐ ఫర్గాట్ యువర్ నేమ్స్, వంశీ కృష్ణ గారు అండ్ దీపక్. థ్యాంక్ యూ.
యాక్చువల్లీ ప్రోగ్రామ్ స్టార్ట్ చేయాలని పెట్టాలి అని థాట్ ఎందుకు వచ్చిందంటే రీసెంట్గా మన దగ్గరే 3 months బిఫోర్ యాక్చువల్గా ఒక ఫ్లాట్ ఓనరు ఎమర్జెన్సీ ఇది లేక ఒక ఫ్లాట్ ఓనర్ చనిపోయారండి, అందరికీ తెలుసు. అండ్ అట్ ద సేమ్ టైం రీసెంట్గా ఒక సెక్యూరిటీ స్టాఫ్ కూడా చనిపోయారు. బికాస్ ఆఫ్ దిస్ ఆ టైంలో మనము చేయలేక, అది ఒకవేళ మనం ఆ టైంలో ఎవరికన్నా పర్సన్కి తెలుసుండి ఇది ఎలా చేయాలని తెలుసుంది కనుక మనం వాళ్ళిద్దరిని సేవ్ చేయగలిగే వాళ్ళము. అట్లీస్ట్ నాకు తెలిసి ఇప్పుడు ఈ సెషన్ వల్ల అయితే మాత్రం ఒక 20-30 మెంబర్స్కి అయినా సరే సెషన్ ఎట్లా చేయాలని అర్థమైంది. మనం దానివల్ల అయితే మాత్రం ఒక పర్సన్ లైఫ్ మనం సేవ్ చేయగలిగాము. బికాస్ ఆఫ్ స్పెండింగ్ ఆఫ్ 1 hour మనం ఒక పర్సన్ లైఫ్ సేవ్ చేయగలిగితే రియల్లీ ఇట్స్ ఏ గ్రేట్ఫుల్ థింగ్. అండ్ థ్యాంక్ యూ సార్ దినేష్ రెడ్డి గారు. యాక్చువల్గా మేము ఆయనకి చెప్పిన తర్వాత నుంచి ఆయన మమ్మల్ని ఎక్కువ ఫాలో అప్ చేయడం స్టార్ట్ చేశారు. మేడం ఎప్పుడు పెడతాం, మేడం ఎప్పుడు పెడతాం అని చెప్పి రియల్లీ సార్ థ్యాంక్ యూ సో మచ్. అండ్ వంశీ కృష్ణ గారు అండ్ దీపక్ సార్ థ్యాంక్ యూ సార్ ఫ్రమ్ అవర్ సైడ్. మీరు ఇద్దరు మా కోసం టైం స్పెండ్ చేసి చెప్పిన దానికన్నా యాక్చువల్గా మేము ఈ సెషన్ వల్ల చాలా నేర్చుకున్నాం సార్. ఇది మాకు యూజ్ అయ్యి ఎవరైనా మేము ఒక్కరిని సేవ్ చేసినా కూడా మేము ముగ్గురిని మేము మర్చిపోలేము ఇప్పటికీ కూడా. థ్యాంక్ యూ సార్, థ్యాంక్ యూ సో మచ్, థ్యాంక్ యూ సార్.
I worked in oil field for long 25 years in Bombay High and in the deserts of Middle East. So there used to be usual practice of every week drill, and we cannot go to the site unless we are trained and we have a certificate to do CPR and many courses like firefighting and other things, and survival at sea and other things. We used to go by helicopter to Bombay High. So this life saving started by Srinivas Garu, Swati Garu. It is an eye opener. Sometimes we can save life, and we have had a fatality here in the building of a worker, and it is the right time we have woken up. So it can happen due to dehydration or somebody is sick also. If he gets a immediate help like this, it can save a life, and it is a good thinking on the part of Srinivas Garu, Swati Garu, Dr. Dinesh. He is in critical care. He never has time, but he made time for us. So we are thankful, and we are a team of 50 doctors almost. I'm in touch with almost all. So all the doctors are our assets. So one by one, we will harness their energy, their knowledge, their experience for our life. And going forward, I think we'll see more sessions like this. God bless you all, whoever has contributed to this. Thank you very much.
Those who made pickle event, right? They are donating this bamboo bag and one BP mission and pulse oximeter and glucometer, and they are trying to, some others are trying to buy this AED trainer as well. So mostly in another 10 days, this equipment will be available at help desk. Anyone can use in emergencies.
2 నిమిషాలు టెన్షన్ వచ్చిందండి. తర్వాత వచ్చే డొనేషన్స్ దీనికి కూడా మంచిగానే వచ్చాయి. ఐ హోప్ ఇన్ ఫ్యూచర్ మనకి బెటర్ ఎక్విప్మెంట్తో అన్నీ ఉండాలని, అందరూ కూడా పాజిటివ్గా ఎలాగైతే ఒక ఫెస్టివల్ చేసినప్పుడు అమౌంట్స్ ఎలాగైతే ఆలోచించకుండా కొడతారో, ఎక్కడో తెలియని దేవుడు మనకేదో వరం ఇస్తాడని చెప్పి మనం అలాగైతే ఎక్స్పెక్ట్ చేస్తున్నామో, ఇప్పుడు మన దగ్గర ఉన్న ప్రత్యక్ష దేవుళ్ళు తల్లిదండ్రులు, తర్వాత డాక్టర్లు అలా రోజులు మారిపోయి. సో ఇప్పుడు వాళ్ళు ఇచ్చిన సజెషన్ ప్రకారం ఇలాంటి మిషన్ కోసం కూడా ఫండ్స్ రైజ్ చేయాలన్న ఇన్ కేస్ నాట్ నవ్ అండి, నేనేం చేయమని చెప్పట్లేదు, దయచేసి ఎటువంటి వాట్సాప్లో పోస్టులు పెట్టండి. ఇన్ కేస్ చేయాల్సి వస్తే మాత్రం మీ అందరూ కూడా వెనకడుగు వేయకంటే ముందుండి, ఓకేనా, ఎవరు నెగిటివ్గా మాట్లాడినా దాన్ని ఒక పాజిటివ్ వర్డ్స్తో మీరు కవర్ చేసి దీన్ని ముందుకు తీసుకుని వెళ్ళాలని మనస్ఫూర్తిగా కోరుకుంటున్నాను. థ్యాంక్ యూ సో మచ్ ఫర్ యువర్ సపోర్ట్. అండ్ మీ సపోర్ట్ ఇప్పుడు ఇక్కడికి వచ్చి ఎలాగైతే ఉందో ఫ్యూచర్లో కూడా సపోర్ట్ ఉండాలి.